Welcome to the explainer. We all know our teeth wear down over time. It's just a fact of life. But did you know there are actually three totally different ways this can happen? We're going to get into exactly what they are, how to spot them, and, this is the big one, what you can actually do to fight back. So you look in the mirror, is your smile wearing out? Look, a little bit of wear and tear, that's normal as we get older. But the real question is, how do you know when it's just normal aging versus a sign that something's wrong? That's what we're going to figure out today. All right, here's the roadmap for today. First, we'll cover what dental wear even is. Then, we'll look at the three big ways it happens: abrasion, attrition, and erosion. And finally, we'll get into prevention and treatment. Let's jump in. Okay, section 1, what is dental wear? First things first, let's get one thing straight. A little bit of tooth wear is completely normal. I mean, think about it. You use your teeth constantly, right? For chewing, talking, literally everything. So of course, they're going to show some signs of a life well lived. The real question, though, is when does that normal wear and tear cross the line into something you actually need to worry about? All right, let's meet our first culprit, what I like to call the outside force, abrasion. The best way to think about this one is, well, it's like sandpaper on wood. It's wear and tear that's caused by something external rubbing up against your teeth. So the official definition here points to any repetitive contact with an external instrument. And you know what the number one offender is? You might be surprised. It's your toothbrush. Yeah, if you're using super hard bristles or brushing your teeth like you're scrubbing a floor, you're literally wearing them away. And it's not just that. Think about those nervous habits. Chewing on a pen cap. Biting your nails, that's all abrasion in action. So how can you spot this? What are the telltale signs? Well, abrasion leaves some pretty distinct clues. For you aggressive brushers out there, you might notice these little horizontal notches on your teeth right near the gums. That's because the enamel is thinnest right there, so it's the first place to go. Or if you're a pen chewer, you might get these little V-shaped divots on the edges of your front teeth. And this is a big deal, because once that outer enamel is gone, it exposes this sensitive inner layer, the dentin, and can even lead to your gums receding. Not good. Okay, on to villain number 2, attrition. This one's the inside job. If abrasion was an outside force, attrition is all about tooth-on-tooth contact. Just picture two stones grinding against each other. That's what's happening inside your mouth. So yeah, the definition is pretty straightforward: loss of tooth structure from tooth-to-tooth contact. Now, a little bit of this is totally fine. It happens when you chew. But it becomes a problem when it's excessive. We're talking about things like grinding your teeth, especially at night when you might not even know you're doing it. Or maybe a filling or a crown is just a tiny bit too high. That can throw off your whole bite and put way too much pressure on one area. Now, this is a really, really important point. There's a big difference between normal wear and problem wear. So physiological attrition, that's just the slow, expected wear that happens as you get older. No big deal. But then there's pathological attrition, and that's when it's gone too far. It starts affecting how your smile looks, how your teeth function. That's when it becomes a real problem you need to address. So where does this show up? Well, it's pretty logical. It happens on the exact surfaces where your teeth actually meet. So we're talking the chewing surfaces of your back teeth, the tongue side of your upper front teeth, and the lip side of your lower front teeth. The classic sign, the smoking gun, if you will, is something called wear facets. These are these little, shiny, flat spots that get worn down. They can almost look like tiny, polished mirrors where the enamel has been ground smooth. And that brings us to our final villain, erosion, aka the chemical attack. Now, this one is a totally different animal. We're not talking about anything mechanical here, no rubbing, no grinding. The best analogy? Think about acid rain dissolving a marble statue over time. That's erosion. Yup, it's exactly what it sounds like. The loss of tooth structure from chemical processes. We're talking about acid dissolving your enamel. And this acid can come from two places. It can be extrinsic, coming from the outside, from things we all love, like sodas, sports drinks, even orange juice. Or it can be intrinsic, coming from the inside, from things like acid reflux or other medical conditions where stomach acid makes its way up to your teeth. And because it's a chemical process, erosion looks totally different. The key thing to remember is that the wear patterns don't match your bite at all. Instead, you get these smooth, concave, almost scooped out surfaces. You might see these spoon-shaped depressions on your front teeth. A really classic sign, especially in patients with bulimia, is when the dentin is exposed on the palate side of the upper teeth, because that's right where stomach acid tends to hit. Okay, so let's put it all together. This little chart is a great summary. You've got abrasion, caused by an external object, looks like V-shaped notches. Then there's attrition, tooth-on-tooth contact, creates those flattened surfaces. And finally, erosion, the chemical attack, leaving behind those scooped-out, spoon-shaped depressions. Simple, right? 3 different causes, 3 totally different looks.
All right, so now for the part you've been waiting for, your defensive strategy. We've identified the villains. Now, how do you protect your smile?
And here it is, the single most important thing to remember. Prevention is everything. Seriously, the main treatment is simply stopping it from happening, or at least stopping it from getting any worse. And that all begins with education, knowing what you're up against. So let's break it down into a simple 3-step strategy. Step 1 is all about education and technique. This is what you can do at home, things like learning to brush properly, gently, and paying attention to your diet. Step 2 is about tackling the root causes. This is where you work with your dentist to fix things like a bad bite or get a night guard for grinding. And finally, step 3 is professional restoration. If the damage is already there, don't worry, your dentist can help replace that lost tooth structure with things like crowns or veneers. So we'll leave you with this final thought to chew on. No pun intended. Now that you know the difference between abrasion, attrition, and erosion, what's one single daily habit you could change to better protect your smile? Think about it, because even a small change can make a huge difference down the road.